Okay, we're going to talk about hypoglycemia, ethanol, and diabetes. So, hypoglycemia is just when your blood sugar is below 54 milligrams per, I think, deciliter. And a couple things can attribute to it. But the symptoms that we got adrenergic, and then neuroglycopenic. These ones are tachycardia, palpitations, anxiety, sweating, hunger. Neurological ones would be weakness, blurred vision, headache, dizziness, cognitive and emotional dysfunction, seizures. So how does this happen? So in ethanol metabolism, if you're in a fasted state, ethanol, when you consume it, produces NADH, which pushes you further away from gluconeogenesis, causing hypoglycemia, because your body's not going to be finding glucose, it's just going to be trying to use that NADH. So that can be an issue. So the other one is diabetes, and diabetes is just the lack of insulin. Really, hypoglycemia comes from taking, I think, too much of a dose causes a hypoglycemic shock. So a random glucometer test with results of greater than 200 would result in a diagnosis of diabetes. If you're fasting for more than 8 hours and you have blood sugars of 126 or more, that would be considered diabetes. Symptoms is thirst, which is also called polydipsia, frequent urination, which is polyuria, extreme hunger, which is polyphagia, unexplained weight loss, and blurred vision. 25% of people who have diabetes actually don't know that they have it. So we also have your HbA1c, or it's also just called your A1C. This is the glycated hemoglobin. It's just when you have glucose bound to the hemoglobin, and this is studied over 3 months, and you get a percentage. Your percentage is supposed to be less than 6.4. That's normal. If it's more than that, then you would be diagnosed with diabetes. So poor diabetes control increases the age receptors. So you have age and rage. Those guys will increase, causing immune dysregulation, inflammation, poor wound healing, which is how we saw in perio. That's how you can have periodontal disease. Peripheral is like the pins and needles in your feet. You can also have cataracts. And then oral candidiasis, which is extra glucose that can be in the mouth, and it breeds bacteria. The bacteria can release all their goo in the mouth, and it makes the tongue look like it has thrush. But yeah, so that's pretty much hypoglycemia in a nutshell.